Well, you're very welcome to today's talk, Thursday the 30th of June. Now, Omicron BA4, especially BA5 cases are going up really dramatically in the United Kingdom, where we have firm data to demonstrate that. And I believe this is also true in Europe, the United States, Canada, and probably in Australia and New Zealand to a large extent by now as well. So we're going to look at that. And the other thing is that there's deliberations going on in the States about a new vaccine for autumn time, for fall. And we'll be looking at the nearer impossibility of getting this right. And indeed, we might even mention the desirability of it. But first of all, a little bit of orientation data. So the number of cases really is just reflecting the amount of testing done in a particular country now. So New Zealand and Australia, the cases are still high. Germany and Italy testing more than the United States and the United Kingdom. So as usual, we need to look at hospitalisation data, which we have here. Australia and the United Kingdom are the highest. Now, hospitalisations are going up in the United Kingdom, no question about that. This is genuine data. Italy, Ireland, the data is a bit behind the times. United States, a slow increase. Canada, we haven't seen hospitalisation data for some time, and Netherlands, relatively low. Now, if you live in Canada, do tell me what's going on. It looks like the Canadians have basically stopped collecting this data, which is a bit surprising. OK, the testing data is very debatable, but the hospitalisation data really is pretty useful. So do let me know quite what's going on in Canada. And if we look at hospitalisations, though, in terms of the whole pandemic, we see that relatively they're fairly low, although the UK is going up now quite a bit. See the very distinct Omicron waves there in the United Kingdom, and a more single wave in the United States. Really quite interesting difference between the countries there. But if we look at intensive care admissions, which are more useful, really. We see that everywhere they're actually quite low. Very high intensive care admissions during Omicron times in the States, but low, much lower in Australia, and they went down all the time since Omicron came along in the United Kingdom. So Australia, a lot of people were naive to the virus. I think that's probably fair to say. The vaccination rates weren't universal by any means. United States, well, all we can think of there really is to blame the comorbidities. So we'll blame the comorbidities, the obesity, the diabetes, the hypertension in the United States that often aren't well managed. Now let's get on to this BA5 immune escape. It seems to be the way that's driving this. So the evolution here doesn't seem to be driven by the fact that this is more transmissible. It is more transmissible because all Omicrons are, but compared to other Omicrons, not more transmissible, but there's more immune escape. It can reinfect people more readily. So vaccines and previous infections are protective against severe disease, so that's all good. The increasing number in hospitals that we've seen in the UK at the moment, just due to the huge numbers, even though the percentage is small because the number of people being infected. I mean, so many people I know at the moment have got Omicron, almost certainly BA4, BA5, mostly BA5. And I'm sure you're the same. So the proportions being hospitalised are small, but they add up to a large number, or a relatively large number. Now, this is Tim Spector's data here, COVID symptom study, Zoe Health Study data. Percentages of positive, people testing positive that were infected more than 3 months ago. So more than 3 months ago. So this is looking at partly it looks at the waning immunity, which is definitely there. But what we're seeing now, let me just show you this. So now there's about 12% of the current infections are reinfections. 3 months ago, it was about 8% of infections were reinfections. And 6 months ago, it was about 5% of infections that were reinfections. Now, if we take periods of more than 3 months before all of these times, there were still lots of COVID around, of course. So what this is saying to me is that it was 12%, it's 12% now, then it was 8%, then it was 5%. This is going up. So a lot of this is driven by reinfections. So the evolutionary pressure for the emergence of BA4 and particularly now BA5, which is the main culprit now, the evolutionary pressure for them increasing is not increased transmissibility, but the fact that they can reinfect more people. it is the immune escape which is the driver of the evolution of the virus now. So already massively transmissible. And it did surprise us initially that we thought, how can it be even more transmissible than something like BA2, which was already incredibly transmissible? Almost probably essentially the same transmissibility as measles, incredibly transmissible. But the increase in the evolution is now driven by the immune escape, the ability to reinfect. And that is happening now with increasingly large numbers. As we say, currently 12% of infections are reinfections. Now, the UK, that gives us an R value of 1.1, so we're going up. 27% up on the week. In the UK, 1 in 21 people are currently symptomatic. In Scotland, it's 1 in 15, which I believe is their high. In fact, it is their highest rate ever for symptomatic infections. Young adults, young people and young adults have got the highest rates at the moment. Now, rates are going up in all age groups, but it's highest in the sort of 5 to 18s and 18s to like 30s age group. The kind of age group that are doing most social mixing in summer. I think that's probably attributable as to why that is. So this will go on for a time, summer mixing, festivals, things like that. These cases are going to go up. Now, we hadn't expected this many cases in the middle of summer. This is a surprise. I've been taken by surprise. I think everyone has. It just shows the transmissibility and the reinfectivity, the ability to reinfect that the new variants have. Now, this is the Zoe data here. So I don't know if you can see that, but that's March 2022 there. So things were pretty high in the beginning of April, but now they're going up again. And this will carry on going up for a period of time. Now, how much it will go up, we don't know, but it will be going up for the next week or two. And because there's so many cases now, we can be pretty sure that's going to go up significantly for the next few weeks. After that, I would expect it to level off. Now, you could argue that this is good because we're getting our infections not out of the way because we can have reinfections. But it might mean there's more immunity around in the population when autumn comes along and the winter months that we will be more worried about, because this is increasing in all age groups despite younger people leading the way at the moment. So now the thing about this, the Zoe data is it's based on people reporting on the app, but it's also completely consistent with the patterns that we're seeing or very consistent with the patterns that we're seeing from the Office for National Statistics. Now, the Office for National Statistics is based on large-scale actual testing. Large numbers of people are tested, different parts of the country. So again, we know this is accurate. But despite the fact that the Zoe data is not being funded, it's still producing very, very good results. So they're doing a good job on that. Office of National Statistics, which is massively well funded, is showing the same trend. Given that the Zoe data goes up to about there now, we know that the next dot on here will be up. We can guarantee that when that comes out next week. So for sure it's going to go up. And will it carry on going up after that? Probably for another week or two. Is it going to reach quite the same peak as the Omicron BA2? Maybe not, but it's certainly going to go up a little more. And the reason I'm using so much UK data is I've got access to it as well, but it is by far the world's best data set, so we can infer that other data sets around the world are going to be similar due to international travel, which makes sure that any new variant gets around the world pretty quickly, as we've seen. This is really quite incredible, the way that the new variants have just spread around the world. So we know that BA4, BA5 is not far behind in Australia, for example, which last time I checked was about 12,000 miles away. Quite incredible speed of transmission. So the Zoe data is 1 week ahead, so ONS data will be up next week. We can be sure about that. Hospital admissions are up 37% on the week. Now, this is quite significant. It is quite high. It's not as high as it has been, but it's putting additional pressure on our National Health Service, for example, which is still trying to catch up with the backlog. So basically, there's still immense pressures on healthcare. Deaths aren't up. Deaths are up slightly on the week, but more or less level. But there probably will be some increase in deaths over the next few weeks, unfortunately, with the lag effect. Not going to be high, but the hospitalisations are up quite a bit. Up-to-date data on how many people this is for COVID as opposed to with COVID, we haven't got at the moment. At the moment, roughly, it's about 60% for COVID, where that's the primary diagnosis. But of course, just like any other viral infection can spark off pre-existing conditions, it can destabilise diabetes, it can destabilise heart disease, it can destabilise renal disease. It basically can destabilise anything, particularly exacerbation of chronic bronchitis and emphysema. So it's not surprising that a lot of these people are coming in with COVID, because these are the people in society that are most vulnerable. You could, to an extent, argue that the main reason they're coming into hospital is the pre-existing disease. But that's not the way we're monitoring our figures at the moment. So that's the official UK data. Do check that out. Now, let's just look at the symptoms, actually, just before we go on to the information from the States. Let's just look at the current list of symptoms. And here we have the updated Zoe list. Now, runny nose was up to about 85%. Now it's only 66% of people have a runny nose. Sore throat is 65%. Headache 64%. Persistent cough 63%. Fatigue 62%. The fatigue seems to hang around for a while. That seems to be a bit of a problem. So these tend to be more acute symptoms: runny nose, sore throat, headache. But the persistent cough and the fatigue can hang around for a week or two, or even longer. Sneezing, hoarse voice, joint pains. I'm not going to read them all out. Fever, chills, or shivers, muscle pains. I'll just put them all in the description, and you can look at them at your leisure. Chest pain is a new one there. So it seems to be chest pain seems to be a bit of a problem with the BA4, BA5. And BA5 is milder than previous variants. So this is the current COVID symptom tracker information, but still causing time off work, still causing hospitalisations due to the large numbers. So there you go. Any of those symptoms in you at the moment should arouse suspicion, and do test if you have access to testing. Of course, a lot of these can overlap with hay fever. So I was talking to someone this morning, and they said they got a runny nose and runny eyes and thought it was hay fever, but I think it turned out to be Omicron, actually. So worth testing if you have the facility to do so. But full list of all those symptoms and the latest figures in the description, and I've also put the direct link to Tim Spector's video, of course, as well. Now, update for the vaccines for autumn time, fall time. FDA Advisory Committee on Vaccines. So they're saying that the deadlines for vaccine formula for October is now. So if we want to have, this is the key point, if we want to have specific vaccines ready for autumn, fall time, winter, when we're going to probably need them more, we need to decide what's going in them now, because there's a lag time in producing these things. BA1 have been tested for some time now, of course, but we don't have any BA1 anymore. BA1's pretty well all gone away now. It's BA2, BA4, BA5. So all that testing that's been done, out of date, I'm afraid. Arnold Monto, FDA Advisory Committee. We're being asked more or less to have a crystal ball. So I agree 100%. So BA5 is the main problem now. So we make a vaccine for BA5. 3, 4, 5, 6 months' time, it could well have completely changed. It's hard to see how this is possible, really. We don't, by definition, we don't know what future variants are going to arise. Is BA5 going to be around for the next 5 years? Probably not. Is it going to be around for the next 5 months? Could be, but probably not. So what do we put in the vaccine for autumn? Don't really know. New multi-strain vaccine. So most of the thinking is that we have some of the original virus, which is going way back to the Wuhan virus, which is pretty out of date now. and Omicron variants is what most people are thinking. So some people on the committee wanted BA4 and BA5, others wanted BA1. Now, why would they want BA1? I'm not quite sure, because that's well out of date now. Is it because they've collected data on BA1 and they wanted to make a vaccine and not waste all their work on that? I don't know. They're welcome to come and tell us. Moderna, Novavax, Pfizer each presented data to support their strategies. So all these different manufacturers seem to want their strategies to go ahead. Moderna, for example, wanted a bivalent, for example, the original version plus a BA1. Got to put a question mark on that because we're now on BA5. Pfizer presented mouse data on BA4, BA5, more up to date, but again, how will it be soon? Now, Novavax vaccine, protein-based vaccine. Now, what they've done with the Novavax vaccine is they actually put the viral genetic material into moths, and it's the moth cell cultures that make the protein. And I must say, I prefer the idea of just giving the protein rather than giving the mRNA vaccines. There's a few question marks in my mind about the mRNA vaccines, but giving a protein, well, that's basically what we've been doing for over 100 years with vaccines. But Novavax vaccine, FDA, I think, have recommended it, but the CDC have not yet operationalised it. I think that's the way it's going in the States. So FDA happy to recommend it. CDC not yet authorised it. Will these new formulations apply to children without testing? I would hope not. But again, you see, if we're going to test them, it's going to be like another 6 months before you would know anything. Is it going to be a local or a global rollout? Well, again, we don't know. So vaccination strategy is somewhat up in the air, and the committee didn't seem to be mentioning natural immunity, which of course now is very, very high. So there you go. Experts somewhat stuck. Now this next bit is purely trivia, so you can switch off the video now if you want, but I discovered this little critter on my shoulder this morning. Classic tick burying its way into me. So I'd be squeamish about this kind of thing, but I just thought I'd share this. Let's see it from another angle there. Again, yeah, digging its way in. Of course, you pull these things out, grip them as low as you can with some grips and pull them out. But unfortunately, it didn't come all the way, so there's a bit of the head left in there, unfortunately, which is a bit annoying. It's nice when they come out intact. Bit more poking around. We did get a bit more out, but that's it. So there you go. Ticks, actually quite common this time of year. Now, you see it's quite red and inflamed round about that, but that's okay. Now, I think I only got this tick yesterday as far as I know. But the risk with ticks is, as we've said, this thing called Lyme disease, which is a bacterial infection. Lyme disease, this is the trivia section we're on now. So Lyme disease, bacterial infection, but can make people very sick, and it's a multi-system infection. Bacterial infection. Now, most times people get one of these, they don't get Lyme disease. So what I'm doing is I'm just sort of monitoring it to see if I get more redness, particularly if you get concentric circles of redness, so-called target lesions. That would be a warning sign. Or if you start feeling ill in any way, then you would take antibiotics. I think the current protocol is doxycycline for about a month, but at the moment I don't need those. But there you go, that's today's trivia. Ticks. Different parts of the world, they carry different infections, of course. Some come from animals, some don't, but you probably didn't want to know that, but that was today's trivia. Anyway, the important points about today is BA5 is just becoming huge, driven by the evolutionary pressure of immune escape and reinfection. And what vaccine, if any, will we end up with for next winter time is currently a bit up in the air. But I do believe that all the infections that we're getting now with BA4 and BA5, although it's not stopping reinfections and minimally symptomatic disease, it will reduce the likelihood of hospitalizations and death later on in the year. The other thing about the vaccine, of course, is it's only going to go into the systemic compartment. When you breathe in the natural immunity, it's going into the mucosal compartment. And as we've already learnt recently, there's a mucosal immunity, where there's antibodies and immune cells that help stop the viruses and bacteria getting into the body in the first place, which of course natural immunity gives us. Nothing I've heard so far on a nasal vaccine that might give that as well. Strange, but that's where we're at. So we'll leave the last word with the tick. So he's no longer with us, and thank you for watching.